Hello, administrators. Today I'm going to be talking to you about the complexities of sex and gender in medicine and how that impacts administrators today. First and foremost, the difference between sex and gender. Sex refers to hormonal and anatomical differences between men and women. Gender refers to the differences between men and women as defined by their particular culture. And currently, women's health and men's health refer to issues specific to their reproductive systems. Gender differences in healthcare in many ways, and that includes with healthcare, prescription of drugs, preventative measures, surgical therapies, and many more. Sex influences health by modifying behavior. For example, testosterone. It can cause aggressive behavior associated with risk-seeking and sometimes neglecting of personal health. On the other hand, there's gender behavior, and that can modify biological factors with their overall health. So exposure to stress, environmental toxins, poor nutrition, or lifestyle choices, those can all induce genomic and epigenetic modifications in adults, children, and sometimes even in developing fetus. However, recent findings show that healthcare needs of men and women differ in more ways than just those. In our field, there have been some challenges with patients who identify with the opposite sex. Electronic health records and laboratory information systems often do not allow for gender designations beyond their assigned sex, thus resulting in misgendering of transgender patients. Additional problems arise for patients who have legally changed their sex designation to match their affirmed gender. For example, many EHRs structures order to patients' recorded sex, thus making it difficult to order a prostate ultrasound for a transgender woman or to create a pregnancy encounter for a transgender male. Healthcare for transgender and gender non-conforming people is extremely limited by a lack of health insurance or other means to pay for medical care used to treat gender dysphoria. The Affordable Care Act, ACA, in the United States has a passage which redefines sex to include gender identity, and it strictly prohibits sex-based discrimination in healthcare. It has been extremely beneficial to the health of the transgender community thus far. The ACA clearly mandates that service providers and agencies provide access to essential preventative procedures and treatments. So, example, mammograms for transgender women or pap tests for transgender men, if deemed necessary by their medical provider. However, in most cases, the implementation of this law currently falls short of mandating coverage for gender transition services, including cross-sex hormones or gender-affirming surgeries. Societal intolerance and stigmatization, combined with discriminatory practices in healthcare settings, have resulted in an extreme decrease of access to adequate healthcare for the transgender community. The differences in biological makeup of men and women extends beyond different reproductive systems, from the way they metabolize drugs to the symptoms that they can get from a particular heart disease. Sex and gender can cause many physiological differences, suggesting different impacts of different diseases, like cardiovascular diseases, asthma, or even autoimmune diseases, and many more are different on men and women. With knowledge of these crucial differences, there is little gender-specific healthcare and prevention, management, and therapeutic treatment of many common diseases that do not reflect the most important risk factors for the patient, which is their sex and gender. This omission is holding back more efficient healthcare, as gender-based prevention measures or therapies are probably more effective than the usual one-size-fits-all treatment or approach, and it would benefit patients of both genders. In addition, a society's gender roles and gender inequalities can influence the health of men and women in very different ways. Healthcare professionals and technicians should be encouraged to use new drugs and new therapies based on gender bias. This can only become possible by obtaining more and more data of prevalence and incidence of various diseases between these two genders. New health approaches for gender-based care that need to be implemented are that we need to examine the potential of wider social and economic policies for promoting gender equity and equality in health. And there are many issues because this is a very complex situation. Health promotion policies are in particular need to be gender sensitive if their messages are going to be heard. If there are so many differences between the incidence and prevalence of diseases between these two genders and sex, it must be seen that the approaches towards their treatment should also differ in the same amount. New approaches should also include public health strategies, new regulations, and training of medical personnel, including technicians. Unfortunately, in healthcare, there are very few efforts being made right now to push forward in the right direction with this sex and gender complexity situation. Thank you.